Hey guys, Dr. Justin Marcagiani here. Today we're going to be talking about hair loss, microneedling, and minoxidil. So excited to dive into this topic. Put your comments down below. Love to see what you're thinking about, and make sure you hit that thumbs up button and subscribe to get more great cutting edge info like this. All right, so out of the gates, I'll put some links down below to some of the products on the microneedling side that I recommend. I've done a video on this regarding face and hair. I'm going to just focus on hair today, and then some of the mainstream kind of over-the-counter medications that are already out there, and just kind of dovetail how you can kind of combine these things to have a really good therapeutic benefit that is exponential in regards to improving your hair growth. So being a functional medicine doctor, I'm more on the natural side in regards to things that you can do. So of course, good diet, good protein, good collagen, all these things are going to be excellent. Keeping inflammation down, good omega-3s, good cod liver oil. Vitamin A is so helpful for reducing sebum in the hair, for providing good skin health in general. We'll talk about tretinoin, which is a vitamin A derivative that allows the transsulfurase enzyme in the hair, in the scalp, to actually help convert and activate minoxidil. Minoxidil or Rogaine is a medication that's an over-the-counter blood pressure medication from like the 60s and 70s, and they found in the studies that there was lots of side effects that improved hair growth, included that. And so people are like, all right, well, let's just try this now. So it comes primarily in 2 and 5% forms, 2% for the women, 5% for the guys. And it does really well topically. It's not going to fix the underlying cause of why you have hair issues. So you have to look at that and get to the root. For guys, DHT or androgenic alopecia can be a big deal. Let me just show you a couple things here just to make sure you guys are familiar with the physiology and what's happening. So out of the gate, we have our anagen. Make this a little bigger for you guys. We have our anagen. This is our hair growing, okay? This is the hair growing, and this could last years at a time. Now, minoxidil works on the anagen phase. Okay, this is where minoxidil comes in. Now, we can use a microneedling device like this that's going to optimize minoxidil absorption, getting absorbed in the channels, as well as the transsulfurase enzyme that takes minoxidil and converts it to its minoxidil sulfate, which is its active form. So many people that don't have good benefits with minoxidil are people that don't have that conversion to minoxidil sulfate. So you can use tretinoin to help improve that, which could be compounded in your minoxidil. You can use microneedling devices along with it, because microneedling is actually shown to actually help with the transsulfurase enzyme. Quick little study on that. Let's see here. Here you go. Randomized blinded microneedling. Oh, that's a different one I'm going to show. Yeah. So this one here, microneedling improves minoxidil response in androgenic alopecia by patients by upregulating the sulfotransferase enzyme. So this is the enzyme that makes it harder for minoxidil to work, because you have minoxidil to minoxidil sulfate, and it's that sulfate form, and you need that transsulfurase enzyme. Now, I'm going to hypothesize that NAC works similarly, because NAC is a strong sulfur compound. I'm going to ponder that that's working on that enzyme too, because there's some studies looking at NAC and minoxidil side by side, and that actually shows that NAC works just as good, if not better, than minoxidil. So I do love NAC because its benefits on glutathione, oxidative stress, etc., right? And you combine NAC with glycine or collagen, then you have this exponential growth factor. So on the functional medicine side, get your diet right, get inflammation right. If you have low thyroid or low female hormones, all those things can impact hair. So when you look at this and you're this person saying, well, what should I do? Work on all the foundational things. And then when you have a good foundation, then you can add and stack a modality on top of this. So with microneedling, it's wonderful because you're able to get into the hair follicles deeper. It stimulates stem cells, blood flow, growth factors. It upregulates, like here, this transsulfurase enzyme. I think cod liver oil would help as well, because cod liver oil is going to be a vitamin A, omega-3 fatty acid. So most omega-3s, fish oil, salmon, they're not going to have that super high level of vitamin A, because cod liver oil comes from the liver. And so because of that, you're going to get that super high level of vitamin A, which is so good for hair and helping with sebum and helping with overall hair growth anyway. That's why a lot of topical anti-aging medications, they have retinol in it, right? Because retinol helps with collagen and overall skin health. So think about that out of the gates. Now, good study right here, randomized clinical study on microneedling and androgenic alopecia. Essentially, if we go down here, they took different groups and they applied minoxidil every day. One group did minoxidil, one group did minoxidil and microneedling 1 day a week. And so you can see the benefit. The starting point was 226 hairs per that small area. It went to 317. 201 was the starting point for the minoxidil group, went to 218. So you can see about a 4.5x increase on the group that did the microneedling and the minoxidil. And again, I think they used the derma roller. A microneedling pen's so much better. We'll talk about why briefly. And so you can see some of the pre-treatment groups, where you can see microneedling group. I mean, look at this guy, total regrowth right there. And look at this guy right here. Significant balding, almost looks brand new. And then minoxidil group only, you can see just minoxidil. Definitely not the same level of benefits. And so how is it working? Growth factors, blood flow, I think creating channels in the scalp for the medication to actually go down there. It increases the transsulfurase enzyme, which is powerful. So how do we do it? Let me show you guys how I do it here. So back to the hair growth. So anagen, this is minoxidil. Catagen, this is where it breaks off. Telogen, this is where it rests, okay? This is where like laser caps try to help bring that telogen phase out. And when you go from telogen where it's resting and you go to a new anagen phase, this is where DHT has a big impact because it creates this shrinking of the follicle. So when you go from telogen resting to a new follicle, this is where the follicle shrinks and gets smaller and smaller and smaller and smaller. So this is where a finasteride or a DHT blocking compound can be helpful if you have androgenic alopecia. And again, you can test serum DHT, but a lot of times the DHT may be independently high in the scalp, but may look okay in the serum. So you have to look at it. That's why if you're going to do a finasteride, like a topical liposomal version is better because you can do lower dose. You still have the maximum benefit of reducing scalp DHT without spilling into the serum, which creates lots of side effects due to allopregnenolone and due to maybe increasing testosterone, which it can, and that's spilling over to increase estrogen. So just a good thought on that. All right, let's just dive in here real quick. So microneedling device, I recommend 16 pins is good. Pretty simple. I buy them in packets. You can reuse them 2 or 3 times afterwards. I put them in a shot glass and some alcohol. I'll put the link down below, the exact one that I recommend. Let's see here. So you can see the device right here. This is a little stopper for it. You pull this out. Those are the pins. You're going to put it in just like so. And I recommend for the hair, especially the meatier part of the hair, 1.5 in and around the vertex in here. If you're going right around the temples to the sideburns, it's a little thinner. So like maybe around 1, but ideally shoot up to 1.5 is a pretty good goal. And so your measurements are here. So this is at 1.5 already. This is 1. And it's got a 0 to 6 setting. I recommend going as high as possible. The more vibration creates that pain gate signaling, the vibration, which kind of crowds out the pain. So it's more comfortable. So it's at 1. I'm going to go up to 6. All right. And so I'll do a couple of spots. So the first thing I recommend is just coming around the front and just going right at the hairline and then going right back. The key is make sure you come at a 90-degree angle. So this is my scalp. Make sure it hits at a 90, not at a 45 or an angle. Make sure it comes straight down. So if you're turning, make sure you just angle that. So pretty simple. I'm just right here. And I'm just tracing it right back. I love the microneedling pen because, I mean, it's 6,000 RPM. So that's 6,000 up and down punctures per minute. Now my hair, I just used a little bit of biotin sodium hyaluronate hairspray. So very, very clean. Like no gel or anything in there. So I wouldn't recommend doing this after a shower if you've already put like a gel in there or something that's not like super clean. So if you're going to do it afterwards, just make sure it's something that's clean. And it does hurt like a you know what. It can. The biggest side effect I have is just I want to basically have watery eyes. Again, the benefit of this is you don't pull out the hairs with the microneedling micro roller. Whew. Whew. Now, I get like a histamine response when I do this. I get a runny nose and runny eyes. And so I just go over it twice like this. And so this is going to be activating that transsulfurase. Make sure your hair is clean. Make sure you've already washed it. It's actually really easy if you have thicker hair already or you just have a lot of hair. You're a female that has hair that just overlaps. It's longer. Do it wet. It's easier to part it. I need to get a haircut today. And so I'm at 1.5. So I try to keep it right at 90. And so guys, you can also microneedle your facial hair. That'll help with regrowth or thickening. And again, if you do minoxidil, just don't do it for at least 30 minutes to an hour afterwards. Some will even say skip. In that study that I just showed you, I think they skipped the microneedling day. So they did it every other day but that. And the other group did minoxidil every day. So the minoxidil group actually had one extra day of minoxidil in there, which is interesting. So even one less day minoxidil with the microneedling, they did better. And so, like I mentioned, this is going to help with the transsulfurase enzyme. So you can activate the minoxidil to minoxidil sulfate. You can also compound in tretinoin with minoxidil, and that'll be helpful. My opinion is I try to go as natural as possible. So starting out, if you're not losing super fast, just do microneedling, do cod liver oil, do N-acetylcysteine, and then in between, there's some studies showing that rosemary does pretty good. Rosemary oil, as well as onion oil. So I found good brands of onion oil on Etsy. Walida makes a really good rosemary hair oil. So if you want to start out as natural as possible, use some of the oils. Microneedle once a week. And that's excellent. And so now, to the scalp, or the vertex or the crown. And again, growth factors, creating channels. So if you do want to apply something, I would be careful what you apply. Make sure you wait an hour or so. These little channels will be open for like 12 hours. And I just recommend kind of gritting it. So if here's my scalp in the middle, I'm just coming here and I'm just coming at an angle. And I'm just basically just gritting it just like that. I try to only go in one direction, so I don't go back and forth. Same thing on a micro roller. And I apologize if my eyes are running and my nose is running. I just get a histamine response from it. And so just take 5 to 10 minutes. Keep it really simple. And if you do your face about 0.5 to 0.75, maybe 1. If you have acne scars, you can go a little higher. You may want to see a esthetician at first just to get comfortable with the length, because they have a lot more experience doing this before you start doing it on your own more frequently. And again, I recommend the 16 because you can go higher, but it's like that whole bed of nails analogy, right? The more nails there are, the harder you have to push. Then with the derma roller works really good if you have really short hair, if you have like a buzz cut. But if your hair is longer like mine, or you're a female, it's going to just rip your hair out. And plus you have to have that consistent pressure. This thing's 6,000 RPM, so all I have to do is just leave it there with the weight of the device. And for the most part, you're solid. So hope that helps, guys. Keep it simple. Make sure you hold the device perpendicular. You can get a little hyaluronic acid, hairspray, biotin hairspray, something that's really hydrating. And I just keep it that simple. And let me just hit all over here just a little more. And in this area too, I just try to, just to get my Norwood 2 better, I'll just kind of trace it right here. Like most painful right there. It's not bad when you get used to it. All right, guys, hope you enjoyed today's video. If you did, let me know. I'll put a link from the device that I use here. 16 pins is going to be excellent. Hope this makes a lot of sense for you. Again, if you want to combine the minoxidil 5%, it's an excellent way to go. Again, tretinoin with minoxidil and or just microneedling device by itself will increase that transsulfurase enzyme. Hope you enjoyed it. If you did, let me know. Put your comments down below. All right, guys, thanks. Dr. J signing out. Peace.